Hello, class, and welcome to Clinical Documentation Improvement. All right, so let's go through the 7 criteria for high-quality clinical documentation. So basically, the 7 steps or the 7 criteria that physicians have to meet is, well, of course, legibility, reliable, precise, complete, consistent, clear, and timely. And we're going to go through each one of those bullet points individually, except legible. I'm sure many of us have seen the handwriting of most physicians, whether if they are older, or the older school physicians to the newer ones. This was a big thing that was pushing the electronic health record because there's been so many mistakes, so many erroneous errors that has occurred that cost many patients' lives due to the fact that we're not able to read handwriting, as simple as that. Okay? So legibility is very, very important. And if you are reading paper charts and you don't understand something, don't assume, please ask. All right, so let's go reliability or reliable. Trustworthy, safe, yielding the same result when repeated, demonstrated when all of the treatments given, and are supported by valid diagnostic treatment. So basically, if you or if a patient is diagnosed with something and you have had a few tests to ensure that's what it is, and the results are the same when they are repeated, that would be a reliable, what's the best word to say? That would be a reliable, valid diagnostic statement, and it's, of course, now the next step from that would be to treat it now that we know that we have a an ailment or disease disorder that now has to be treated. Okay, so the reliability part of it is repeating the exams, okay, to ensure that this patient does have what we suspect the patient has. All right, precision. Accurate, exact, strictly defined, and spaced by the level of detail in documentation. Example, chronic diastolic congestive heart failure as opposed to congestive heart failure. Okay, so this would be an example of, the last bullet, chronic diastolic congestion heart failure as opposed to just congestion heart failure. It's either diastolic or systolic. So depending on what area within the heart that is being affected, to be precise, you have to actually list where the most infected part is. Because congestion heart failure can just be your heart is failing, but we have many departments in our heart. So if it's diastolic that's causing the congestion heart failure, then they will be able to treat the diastolic problem that's causing the congestion heart failure. So it's very important to be precise, exact, and accurate when you are diagnosing the patients, or shall I say the physician diagnosing the patients. Okay, completeness or complete, having the maximum content, thorough, all concerns in the record are addressed, administrative issues are addressed, date, time, and authentication. Signatures are a very, very big problem for most physicians and most facilities, especially when you're working in surgery centers, ambulatory surgery centers. I found the best way to resolve the issue is by compiling all of my charts for the same physician, and when they arrive for their scheduled surgeries, I would bring all of those charts to the physician. I would stand there and make him sign off on all of those charts. Because remember, if there's nothing you can do to change the signature date. Once it's signed and the date that it's signed, that's it. And that's very, very important when it comes to reimbursement, being compliant, so on and so forth. Same thing with time and date. If somebody time-stamped it and the patient expired, and at that time the patient was still alive, that would be an example of time and date. You have to be very, very, very conscious of what you're inputting into the system. And I have to say, everybody is a data entry, it performs data entry skills, clinical or non-clinical. Physicians and nurses and MAs, they have to go on the computer just as much as we do to input their information on the financial side. Okay? So make sure everything that you input into the computer is correct, and that's why I always tell you to perform a quick audit to ensure that claim will be reimbursed. Consistency and consistent, not contradictory. From start to finish, documentation makes sense in relation to the best documentation in the record and does not contain unexplained conflict with other statements in the record. That's pretty straightforward. An example would be, the patient came in for, let's say, a myocardial infarction, and then for some reason they put the patient had a motorcycle accident 17 years ago that fractured their humerus. That's not consistent. It has nothing to do with their current visit. And anything contradictory, you can think of the same type of scenario. What would be an example for a contradictory? I can't think one at this point for contradiction. But the most important thing is that we want to ensure that the documentation in the record is complete. There's medical necessity. There's nothing that needs to be added outside that does not pertain to the current situation, okay? You don't have to say that you broke your leg 4 years ago if you are in the office to receive an annual checkup, because that has nothing to do with your visit, which falls under consistency and consistent. Remember, all of this kind of coincides with each other. They overlap, so that's important to keep in mind as well. Timely, at the right time. Lateness cannot be fixed, and late entries will always be late. Okay? This is where it comes in with the MAs, the coders, the billers. We want to make sure the physicians sign their charts right away. There's no late entries. There are late entries. They say late entries. If there's any errors made into the charts, the errors will stay in there, and they will have to be, what's the word I'm looking for? They will have to be, there will be a red mark across the information that's an error, and you'll put your initials and then the date, okay? But once information is inputted in a patient's record, it has to stay in there always, okay? So kind of keep that in mind as well. All right, the role of the CDI program. Improve clinical documentation, provides mechanisms for the coding staff to communicate with physicians, ensure appropriate documentation to support and reimbursement. So again, that's why all of our jobs pretty much coincide together at some point or another, or they cross each other. And that's why whatever job function you perform, you want to ensure that you perform a quick audit to ensure that all the information on the insurance card matches what is inputted in the EHR. And then, of course, the coding as well. Okay? And then we constantly update the CDI programs to ensure we are still in compliance. Joint Commission, CMS, OIG. Okay, so this was Chapter 10. Thank you for listening, and I will see you on the next chapter. Take care.